Hi, Betty. My name is Carl. I will be your nurse today, and I see in your chart your physician has ordered us to insert an IV for you for some fluid and some medication. First of all, Betty, wash my hands. And then can I just have you verify your full name and date of birth, please, which I will compare to her wristband, and it is correct with what she's telling me. So, Betty, have you ever had an IV before? She says yes. I ask her if she's right or left hand dominant. She's right hand dominant. So I'm going to tell her that we would like to put it in her left arm so she has free range of motion with her right. I check to make sure she hasn't had a mastectomy or doesn't have a fistula in her left arm or never had any limbs removed on that side, and she says no. She's had them in her left side before, and that is fine. Ask her if she has any iodine allergies or tape allergies, so we know whether we can use plastic tape or need to use paper tape. And she says she does not have a problem with either. Explain the procedure to her, even though she's had an IV. Just tell her that we're starting the IV with a needle that just gives us access into the vein, and a plastic catheter will get slid into her vein, which is left in place, needle is withdrawn, and that gives us access to give her fluids and medication directly into her vein. She understands all of that and is okay with it. I'm checked with her to make sure that she is capable of keeping her arm still and in a dependent position while I'm doing it, and she understands and is perfectly fine with keeping her arm still. So I have a couple of supplies here. I need to get ready a towel that I can put under her arm just in case there's any blood that drips off or I spill any fluid, saline, any type of thing, just a protective barrier. I got my tourniquet. I'll get a couple pieces of tape together here. Got my Tegaderm covering for the IV to hold it in place. I have my 10 milliliter saline flush that I'm going to hook up to my line, and I don't want to contaminate the end because it is sterile. If I did, I could use an alcohol wipe and wipe it off, but it's just easier not to. Hold it upright so the air bubbles all run to the top, and I'm just going to prime my line, pushing fluid and the air bubbles up out through the top. Line is primed, cap is on, so it's sterile. I can set it down. Ask Betty if it's okay that I lay my supplies next to her. She doesn't mind. She said she's going to hold still for me. Got my IV catheter. I have some extra gauze just in case it dribbles. I can clean up the side after I'm done before I put the Tegaderm on. And I have an alcohol wipe. So I will wash my hands, put on gloves. My hands are washed, I'm putting on gloves, and I'm going to check for a proper IV site. And we'll say this is wrist, this is elbow. I want to stay above and below both those joints. Don't want to go into a joint if I don't have to because it gives her free range of motion without having her bend her arm and occluding the IV. We'll put the tourniquet on 15 to 20 centimeters above my planned site of insertion, and don't want to leave the tourniquet on for more than 2 minutes to restrict blood flow. Leave a little tab. I'm checking her radial pulse. She still has a good radial pulse, so we're not obstructing arterial blood flow. Looking for a nice straight line, like I said, between both joints. Should be, good and straight, no bulges, which would be indicative of valves, which can stop the progression of your catheter in, block flow of the fluids you're trying to get in, so it's just best to avoid them. Should be nice and bouncy for our purposes, so I'll undo that. I have a good site I'm going to go with here. If your patient doesn't have a good vein, you would obviously take the tourniquet off, but you can have them clench their fist, which can get the blood flow pumping, get your veins to stand out more. They can rest their arm down in a dependent position to get the blood flow to drain down. Or you can take a hot compress and lay it on their arm for 10 to 15 minutes, which can help get the veins to stand up more. And that's about that for that. Betty says she's able to keep her arm still here for me and hold it. If it was a younger child, I would probably want to get somebody else extra in here to help hold the arm in place while I'm trying to insert the IV. Sometimes with older, more frail patients, instead of just pulling down taut on the skin and going in, you can help hold the vein in place by putting your extra finger above your site of insertion, and that stops it from rolling off when you're trying to poke in. A lot of times they want to just bounce and roll off and you don't get access into the vein then. But Betty's okay with everything and she's ready to go here, so I'm going to clean the site of insertion with the prep. And I'm going in a circular motion, working my way out. And while that's drying, I'll get my tourniquet set. And checking for the radial pulse again, and it is fine. I'm not blocking any arterial blood flow. I have my IV needle catheter here. I'm checking to make sure that it slides freely on the end. The site is dried. I'm going to pull taut at the skin at the bottom with my bevel up. I'm going to go in at a 15 to 30 degree angle and into the vein until I get a flashback up in my window here, which I do. Bring the needle down parallel with the skin and advance it another ½ centimeter. Once I'm there, I can, without touching the catheter, because we don't want to contaminate that before it slides into the vein, slide that off and into up to the hub, into the vein. And at this point, I would retract my needle, but because I'm going to reuse this needle for practice, I'm just going to set it aside. I can undo the tourniquet, pop my cap off, and screw it into the hub without touching either end because those are sterile. They need to stay that way. With hanging on here, not letting go, maintaining the catheter so it doesn't pull out, or if she moves her arm, it doesn't go, goes with my hand, stays with it, holds it in place. I got my flush hooked up that has been primed. I'm going to back draw so I get blood up into the tube, which I do. And then I'm going to slowly push forward and flush the saline through to clear the line, make sure everything is flowing fine. Asking Betty here that if she's having any discomfort. I'm not noticing any bulging, infiltration type stuff going on, no redness around the site. It's flushing fine and easy. She's feeling no pain. So then that went in great. I can leave that there. I'm going to maintain holding on to the hub while I get my tegaderm ready to be put on. Put this over just the hub of the catheter without going over where it screws onto the saline line. There. Grab an extra piece of tape. And I'm going to go over the saline screw cap, not going over the total joint, because if they need to take that apart for some reason, it's a lot harder to do when there's tape over the top of it. So I finished flushing through the rest of my saline. I put all 10 in. It's flushing fine. I can disconnect now. I'll grab my other piece of tape and just make a little loop out of it, taping that down up and out of the way so there's ease of access and it's not hanging there for it to get hooked on or anything. I can clip off my line to stop any backflow into the tube. Take my little piece of tape off of this for my tegaderm to put on here without going over the top of the site of insertion, because you need to see that in case of infection infiltration. They need to make sure that that site looks good. You don't want to block that view. Put your date and time that it was inserted. Per facility protocol, the line needs to be flushed every certain amount of hours to make sure that the line stays patent when not in use. Also, the IV needs to be changed. Sites need to be rotated every certain amount of hours per facility protocol as well. So Betty did fine. The IV is inserted. It's flushed through. I have it clipped off and locked. It's taped. It's signed. It's dated. Everything went well with that. And I just need to Clean everything up, make sure she's in a position of comfort, has her call light, doesn't have any more questions, is still doing okay with her IV, no sudden pain or anything with it. She doesn't. My needle would go in the sharps container, but like I said, for practice, I'm going to be reusing that. I would take off my gloves, wash my hands. I need to document the size and gauge of the needle that I was used, the site location that I put it in, the amount of mLs that I used flushed through the line, how well the patient tolerated it, and I believe that is it. Like I said, make sure your patient is educated and understands what's going on when you're doing it, and everything should go smoothly.